Okay, so I did say I was gonna make 3 parts. Wanting to becoming a CNA, a certified nursing assistant. Okay, so when you first get hired, you want to know what's your schedule. So they have 3 different types of schedule times. Put yourself first. You don't need no stress because work is going to be stressful. Keeping track of what the patients are doing and how they're operating day by day, so nurses or anybody, doctors, can see what's going on, the history. So make sure you're doing that every chance you get when you start working. Make it a priority to know what is the history of where you're working at. It will help you kind of give you an idea how to move around. There's usually supplies that you're gonna need to work with, washcloths, linen, blankets, sheets, soap, lotion, razors, shaving cream, all the hygiene products and anything to work with. You're gonna need all those supplies. They always have gloves whenever you're going to any room. Have things in my pocket like trash bags, cream, sometimes soap. Like, better to stay ready than to get ready because you will save so much time. When you're transferring patients into the wheelchair, make sure you're using proper body techniques. Never ever use your upper body to do most of your work. Always use your lower body. Make sure you always have your gloves for anything. They won't get offended. I used to think, oh, that's a little offensive, like to just even touch somebody's hair. No, make sure you use your gloves. The more you are aware of your surroundings, the better you can react whenever something's gonna pop off. When you are changing the briefs, make sure you're doing it at a timely manner and don't ever leave your patients soak or not change. If you're working morning shift, make sure you get to know your patients. So talk to your management, your unit manager, or your past CNAs who know the patients or the residents. What is the routine like? Who gets up for lunch? Who gets up for breakfast? Who I need to put to bed? Who needs to get out of bed? Who needs to go to activities? Who needs to go to the doctor appointment? Who needs to go to dialysis? Who needs to go out to smoke? All of that. Like, top 3 is feeding, changing, transferring, getting up out of bed, and shower. Mostly day shift, mostly do showers. Rarely there's showers in the evening. What you're gonna do when you see family in a room and you need to do your job, you need to take care of them or change them, tell them, I'm gonna need 5-10 minutes. If you please, can you step out the room so I can take care of your family? Something between those lines. I just made that up. Make it more better, more professional, more sweet, however you want to do it. You never want to take care of a family in front of a family member because it's not going to live up to their expectations ever. I'm working in a place where they'll give me about 10 to 15 patients, and honestly, I don't think it's normal. But they think that's a reasonable amount of people to take care of. And with that being said, you need to get to know your patients. Know what they like, know what they don't like. Okay, so when you're going to greet your residents, always make sure they're awake when you come in from work. When you come in, you're gonna check your rooms before you start anything to make sure they're alive, they're doing good. Hi, so-and-so, I have your breakfast. Hi, I have your lunch. Hi, I have your dinner. Hi, are you finished with this? Okay, take everything out. Make sure you don't leave trays ever. Do your part, do what you gotta do. Feed your people in a timely manner. Always have your timer on. You don't wanna keep feeding with no liquids. Don't do that because you wouldn't like that. Sure, they have their straws. Make sure they have everything they need to eat with and be aware that they have food coming. I realized that in the 2nd month working that I was always being put in the hard section because I was the new girl. So honestly, they will take advantage of that. And honestly, don't be offended because honestly, I can do anything now. Okay, so you have patients who are independent, dependent, and total care. Independent are people who can do everything by themselves. They don't really need care or assistance. Dependent, they need care, and sometimes they don't really need assistance in other things like feeding, but they might need help with changing their briefs. So stuff like that, you need to be aware of those terms. And then you have total care. Total care is like you do everything for them. Just make sure they're eating. Like if they don't force them, okay? If they refuse, leave them, okay? Let the nurse know. There's gonna be times where you're gonna be dealing with patients and residents who are very aggressive, nasty, mean, obnoxious, flirty. Deal with that without dealing with it. Do not argue with these people, okay? These people are in places where they shouldn't be having to argue with you at all, okay? That's not what you're here for. Okay, but like, find a solution, okay? Speak, be clear, be warming. Don't be cold. Talk to the nurse, or say, you know what, I'll be right back. Take a breather, come back. Make sure these residents are, you know, feeling homey. Make their beds, okay? Always make their beds, fix their room, make sure their colleagues are with them. Make sure if it's a new day, open the curtains, open the blinds, make them breathe, let them see light, you know? Just do things that you would feel or like if you're at home. They have little cardex or care plans that you can look at that can make you more understand why the patient is here, or ask the nurse like, what's the history with this person. Answer the call light. Make sure all your call lights are answered and you're doing the work to make sure their needs are fulfilled. While you're in the room and you answer their call light the first or second or third time, get everything they need. Ask them, hey, what will you need afterwards, or is there something I can do? Hey, I'm gonna be with a patient in a little bit, so if I don't come back, just don't be, you know, thinking I'm not coming to answer your call light. Like, communicate with them, okay? If you're doing your job clean and how you was taught in the school, there's no need to do little shortcuts, because these shortcuts majority of the time don't even make sense. Like, if there was a shortcut to do these type of work, why do you think we would not do them in the first place? So some nurses can be very not cooperative, or they're not team players, just like CNAs can be together, working together. So, you know, if you have that situation, don't feel like you're alone, because that can be very common. But just use it as a way to know that you should be doing your job correctly to prevent any future bad habits or situations that could be prevented. That is my ultimate CNA guidelines / tips and advice and everything like that. So I hope you learned something from this, and if you know anybody who's becoming a CNA anytime soon or thinking about it, make sure you share this video to them, as well as if you have any extra tips or comments, make sure you comment down below so we can know what we can do as a CNA in the community to make our jobs more easier and more effective. Because honestly, I'm still learning, but this is what I learned so far working as a CNA, almost close to, you can say almost 8 months now, believe it or not. It went by really fast, but it was not an easy process, but it had to be done. So that is all. Thank you so much for watching. See you guys in my next one. Bye.